Hello friends, I am Dr. Rajendra Shinde, practicing dermatologist from Pune. Today I will be sharing a few insights into this condition called herpes zoster, or commonly called as shingles or nagin in the local language. Herpes zoster or nagin is a condition which is caused by herpes zoster virus, the same virus which causes chickenpox or varicella when the patient is young. Now it's the same virus, the herpes zoster virus. When first time it enters the body, it causes varicella or chickenpox. After the chickenpox, the virus goes and resides in the dorsal root ganglia near your spinal cord and rests there. It tries to multiply, but your immune system doesn't allow it to manifest onto the skin. As the age progresses and your immune system goes down, the virus gets a chance to multiply and manifest onto the skin in the form of this, what is called as herpes zoster or shingles. Now, what are the manifestations of this herpes zoster? You will get the main manifestation as pain. Now, this pain could be in the form of burning pain, stabbing pain, or lightning pain, or shooting pain. Now, this pain will be restricted to one side of your body, and it will be in a dermatome, or the area which is covered by a single spinal nerve. So, now how do you know whether you have got herpes zoster? The only complaint of herpes zoster is pain and pain itself. Now this pain could be of many types. It could be shooting pain, it could be burning pain, or it could be a lightning pain. Now this pain restricted to only one side of your body. Now why this is so? Because herpes zoster attacks only one spinal nerve and it doesn't attack the another spinal nerve on the other side. So there itself another myth is that if the mouth and the tail of the herpes meets, you are going to die. But this is a myth. Nothing happens in such way. Now how to diagnose herpes zoster? You just touch your area. Normally if you touch, you should get a touch sensation onto that area. But if you are touching that area and you are experiencing a pain sensation to that area, then that could be herpes zoster. Please consult a dermatologist immediately to prevent damage to your nerve. Now once you are diagnosed with herpes zoster, don't announce it on loudspeaker. Don't tell any of your friends or relatives apart from your near relatives who are near and dear to you. Now why this I am telling you? Because they will tell you whole lot of therapies for herpes zoster which are hardly of any use. Please see your dermatologist immediately rather than venturing into such activities. Now what will your doctor do for if you are diagnosed of herpes zoster? Your doctor will prescribe you a drug called as acyclovir or valcyclovir, a very good drug against herpes zoster which cures the infection. He may give you a painkiller along with antacids and some soothing agents like calamine lotion to keep you cool. Just like another viral infection, the most important part from your side is rest. You have to take rest at least for 7 days. That is of utmost importance. Now what to do about the pain part? Now you have to fool the brain. Now this is the only time we advocate the use of mobile, which may distract the brain from the pain of herpes zoster. Now what are the complications of herpes zoster? There are many complications if the patient is not taking proper treatment from a dermatologist. You may get secondary infection with bacteria. You may get scarring or pigmentation to that site where the vitiligo is. Then you may have serious complications involving the brain which is called as encephalitis. You may get vasculitis and many other nerve paralysis as well. So what if you don't treat your herpes zoster? Now herpes zoster has so many complications. It will cause scarring at that site if you are not treating it early. It may cause secondary infection at that site which is also dangerous. It may cause even more dangerous complications like inflammation of the brain called as encephalitis or various nerve paralysis. So to prevent this, you have to treat the moment you are diagnosed with herpes zoster with appropriate treatment which your dermatologist will recommend it to you. So then, is there any prevention to this? Yes, nowadays there is a vaccine which is available. Of course, there are two types of vaccines which are available. One which uses a live virus and one which uses a component of the virus, the glycoprotein A component. If given the choice, you should go for the glycoprotein E vaccine which is available in India also. The dose of the vaccine is 2 doses apart which is given on the first day and approximately 2 to 6 months after the first dose. It is given intramuscularly. Now the efficacy of this vaccine is tremendous it confers about 90% of the efficacy in a normal immunocompetent or a normal individual. Now it can be also given to those individuals who do not have immunity to 100% mark, like diabetes, or some immunocompromised individuals may with malignancy or HIV infection. What is the efficacy in those cases? The efficacy is slightly less, it ranges from 60 to 90%. Now the most important part of this vaccine is that it confers immunity to you and prevents you from herpes zoster for a very long period, and this long period could be 30 to 40 years, in short until your death. So please take this vaccine recommended by your dermatologist. So friends, I hope I have thrown some light on herpes zoster, its treatment and prevention part. To assess more such videos and any other queries you have, please visit DermaVidya.com. Thank you.
For more such videos, visit or log into dermavidya.com.